COVID to start with, where we as an entity had responsibility to really make sure that people that were home alone, that were sick, needed help, and the resources that we had as humans just went away from one moment to the next. And when you have people that are able to traditionally go into homes, when that means just suddenly just disappeared, something had to give. And that's when we can actually deliver to them the best possible way to be engaged with them. And technology was the answer. Innovation is caring. At the center of innovation is caring. It's a vehicle to propel your caring. If you care about who you're trying to help, innovation is just a vehicle.
Welcome to the Feria TechCast, where we bring you all things science, engineering, technology, and innovation. Today, we are joined by Josh Klein, a certified paramedic turned tech-driven entrepreneur and the founder and CEO of Emerest. With a unique background in emergency medicine and health tech innovation, Josh leads a rapidly expanding network of over 10,000 caregivers, leveraging platforms like Emerest Connect and You at Perks to redefine aging at home. His work combines compassionate, person-centered care with scalable technology solutions, focusing on caregiver empowerment, patient safety, and modernizing home healthcare delivery across multiple states. So, Josh, welcome to the show.
Thank you very much. Excited to be here and thank you for having me.
All right, so let's start at the beginning. Your career is a fascinating blend of deep hands-on clinical experience as a paramedic and high-level tech innovator and CEO as well. So, what was a specific moment or experience that made you realize technology could radically transform home care?
COVID to start with, where we as an entity had responsibility to really make sure that people that were home alone, that were sick, needed help, and the resources that we had as humans just went away from one moment to the next. And when you have people that are able to traditionally go into homes, nurses, doctors, caregivers, when that means just suddenly just disappeared, something had to give. And that's when, instead of taking it in a bad way, it says, this is the time and opportunity, first and foremost, as a CEO, to make sure that the responsibility given to me and to the people around me is how do you do certain methods that their service shouldn't be disrupted, that we can actually deliver to them the best possible way to be engaged with them. And technology was the answer. Under extreme circumstances, were forced to do so. As they say, necessity is the mother of all invention. And that necessity, the silver lining of COVID was that. And I think it's one of my proudest moments is to identifying that and not just hiding under the cover and saying, hey, there's nothing we can do. No, let's see what we could do. And we did enormous amount of changes with technology. So that was that switch. So, and we've done lots of good things with that opportunity.
That's inspiring. So, Mr. Klein, could you tell us about Emerest and you at Perks? So, what do you do there? I mean, who do you offer services to? What's the company about?
Okay, so we are a home care based services entity, which means that the home care population and the home care concept, people want to stay at home. 70% of people want to end with their end of life should be at home. And nobody wants to end up being institutionalized if they would do anything to stop that. So at the core of what we do is we deliver a care, clinical care within our continuum, people that leave the hospital after a surgery. So we have our what's called the home health nurses, physical therapist, occupational therapy based on their needs post hospitalization if they needed to go to the hospital. So we keep them at home and make sure that we have the right tools, the right staff, um, great nurses, great doctors, great physical therapists, as well as caregivers for people that need their daily chores that they need help with, laundry, daily activities, um, cleaning up, making sure that there's no clutter, that they shouldn't trip. A lot of these things, they're daily activities. And that at its basis, that's what we provide for close to 20 years since I'm 20 years old, have been doing so and doing so successfully by administering those services for the elderly population for 65 and above. We branched into the pediatric area as well, but the majority of what our mission and what we do very well is their geriatric population. And the more we went into it, and like I said, COVID made us realize that if we're going to effectively administer services and having the patient in mind and their family, we need to do a lot of things not non-conventional ways. What are the things that we can do differently? How can we be different? What are the ways that we can be different? What are the technologies that we can put in place that are not so foreign to that population? It's very, very easy to just throw out like a pitch deck and say, oh, we do technology. We do AI, the new flash words and the new fancy words that are out there. Is if you stick to understanding what the patient needs and apply technology, especially that we're blessed because we're doing the things right. So a lot of people come to our doors for help, is to be able to use technology to be able to facilitate that growth and that scale. And we were very, very successful at adding technology to keep these patients at home, happier, healthier, and longer. And that is the basis of what we do in all our companies. We started in the state of New York. That's where I'm born and raised, in Brooklyn, New York. We expanded slowly into areas next to New York, such as New Jersey, then Connecticut, then Pennsylvania, and now as far as out as St. Louis, Missouri, all with the same mindset, never losing focus of the person that's sitting at home, the person that's delivering that thing in the home, understanding how important it is to make sure that the people that are delivering the services are cared for, making sure that you can only give from yourself if we take care of them. So if we take care of our employees, they have the tools, the means, the mindset, the mental health in order to deliver further care.
Amazing. So, you've pretty much did a good job in telling me about the vision and, the mission of your companies. But I'd still like to know what are the differences between Emerest Connect and you at Perks? Like, are they different companies or platforms? And like, what do they do specifically?
How are different? I'm glad that you're asking. So, well, the two things that you're mentioning is let's start first because that's where it starts. If you do not have happy employees, if you don't have employees that are taken care of, us two, we're two men speaking on the phone. Um, uh, you know, we want to feel good about ourselves. We want to feel uplifted. The majority of the workforce in healthcare are women. 97% of the people that deliver care in healthcare are women. And what we realized is if we're not going to uplift them and we're not going to give them a space to feel empowered, to feel that they are part of the clinical and the outcomes of the patient, we're not going to be successful. And the only way to do so is not just, yes, pay them on time, pay them the best possible rates, fight for them, be in the position in government, in entities, insurance payers, for making sure that they get the paid the best possible. But there's also a component of the social and determinants of health for people delivering care for this population. Taking care of an elderly person is not easy. It's not for the faint of heart. And when I was brought up that way, my parents were in this space. My mom had a nurses agency. So I grew up in a home where I saw my mom around the kitchen table have nurses where she gave them dinner. She cooked for the kids, but she also cooked for the nurses. And I was like, always, you know, what was the meaning behind it? And that's one of the things that I learned, just by growing up, is treat them like your own and make sure that they're, taken care of. So how do you do that when you have thousands of caregivers? How do you make a platform that gives them, when you're dealing with home healthcare is in thousands of different locations, right? Everybody lives in their home. How do you make that person that lives in their own apartment, takes two buses, takes their kid in the morning to drop off at daycare or school, then has to take a bus, a train, and go, and that, so they're all over the place. How do you make them inclusive? How do you make them feel that they're part of something when their job is outside? So the brainstorm that we had, that one of my proudest things that we've done is we've built these buildings wherever we operate is like a lounge area that spans, some of our locations are 4,000 square feet big. And in there, where we have a space for caregivers to come and get their hair done, manicures, pedicures, all services that a woman wants to feel good about themselves. Have these cafe lounges where they can just sit and relax, speak to like minded individuals that care for patients, have these rooms that they can meditate, have little services that where we have social workers that speak to them. So that is just something as simple. It's not simple, it's very costly, but the reward is so much. And, it's very hard to come across camera when you see women, minority women that picked a job to care for someone else. There's something special about somebody that says, I want to make a career about caring for somebody else. So to take that and come into our locations and see how this home health aide, nurse, whoever it is, gets pampered, walks out, they come in with one, and you see the smile on their faces, and you see how they walk out empowered, and they come at any time that they wish, on the weekends, during the week. So that gives them a real sense of a belonging to the company, to us. And more importantly, we show them that this is not your typical place. This is not just somebody that's just chasing the patient, equals the numbers, here's your paycheck and go. How do you make them grow? How do you empower them? And that gave us a real strong platform to do so. And our results are absolutely astonishing and amazing. So that is the perks, what we call it's you, which is the employee. Perks. It's a perks for you. It's something that you deserve, well deserved, and we want you to feel better, feel good about yourself so you can deliver for our patients the best possible outcomes. But that is on the employee side.
That is fantastic. Yeah. So I know you may. I'm not exactly sure. Maybe you'd have to confirm this. You might be more of the paramedics guy, but I like to talk about the tech stack of Emerest a bit. So for our audience of engineers and developers, what does the architecture of a platform like Emerest look like? So how do you integrate 24/7 telehealth and remote monitoring into a platform like that?
Absolutely. So we spoke about the perks side of it, and now we'll address the Emerest Connect side. Remote patient monitoring is also a buzzword, frankly, that became very popular, and rightfully so. This is not knocking what people are doing. Remote patient monitoring is a simple concept, which means you monitor patients remotely, which you take their vital signs, understand their blood pressure going up, going down, somebody that's a diabetic, what are the things that a specific patient needs, checking the blood sugar level. And when we delved into making sure that we have a better view of what's going on in the patient's home, so at the center of it is monitoring the patients with devices. And that is what we've done. Is first and foremost is any patient that comes into our continuum gets an evaluation of a nurse, understanding what does the patient need, what are their diagnoses, what are their social issues, what are the things that they need in order to be at home and do well. So based off that assessment, we put in certain devices. And all these information data is only as good as what you're going to use it for. Just collecting data for the sake of collecting data is there's entities that do that, and they do that fairly well. For us, it was what information that we receive, what are the actions afterwards that we take that is going to make a difference in the home. So if we collect information on the monitoring, if the patient's blood pressure is high, what did you do to lower that blood pressure? If the patient's O2 sat lowered, if their baseline was 94, 95, and they went to 90, what did you do about it to stop it? If we see a trend, the nurses see a trend from all this monitoring. What are those things that trigger that made it worse? And what we were able to accomplish and actually do with technology is capture that information, make it with alerts that go to nurses in priority, making sure that we have thousands of patients. You can't see thousands of patients at once. So first and foremost is it is built on a way of a sense of priority. What are the ones that are most important and needed to be seen? That the nurses that have a visual on the patients. These patients today are priority number one. There are 100 patients that need immediate interventions, such as if somebody is truly having an O2 sat, their saturation is low where it's a dangerous level. What intervention do we have? So, talk about my background as a paramedic. One of the things that's where I've seen personally is there is so many things that we can do at home, and I've seen that and I've witnessed that personally. Um, that if we had, and I've in my daily volunteering, is if I had an extra tool or two, or if I had a doctor on call, or I had something, this patient would never have to go into the hospital. And that's what we've created, a tier system, a pyramid system. And that's what our technology team built, is a system that can be visual, can be seen, and they can actually intervene. So if their O2 sat is below a certain threshold that's dangerous, that's eventually going to get worse, that they're going to end up in the hospital, we send in a team of paramedics to see what is going on. What can we do right now? And sometimes it's as little as a problem that if the patient is on home oxygen, sometimes the tubings is just kinked, it's just stuck. So the oxygen that was supposed to get to just never got to them. And that's something just that you have to see visually on the eyes. And in some cases, their blood pressure, their medication that they have was, let's just say, conversation was 25 milligrams. The doctor comes on right onto the screen and says, let me see, the patient's really blood pressure, the last couple of readings was increasingly increasing. Let me change that medication right then and there. Ordinarily, when a paramedic, if I would come in without knowing anything, without having any background, if somebody's blood pressure is that high, the natural reaction is, oh my gosh, this patient needs to be put on a cot, put into the ambulance, taken to the hospital for no reason. Otherwise, the hospital is not going to, the emergency room is not going to do anything different than a doctor seeing him and doing an intervention and changing their medication. So from the clinical side is all these tools that give our nurses a vision, an insight, a priority. That's what we were able to think. And they also have on the technology, what resources do I have instantaneously? Which doctor is in the neighborhood? Which tech is there if a patient is coughing in our continuum? And that's what we built out. Who's the closest tech that has an x-ray machine to take a picture of their chest, to take a picture of their lungs, so a doctor can give them antibiotics? So all that was built with the best possible team. Super proud of our technology team, that they understood, and the more they understand and they're involved, and you were asking for your audience in the engineering and all that stuff, the more they're engaged in understanding the mission, the more they really, really said, you know what, let me listen to what their objectives are, not
Mm,
my own. If they're giving a task, I know that there's so many times that people in technology, they're product managers, as they're called, right? And product managers are given a specific thing. And I think that If they're given just a specific item line, they will execute potentially. But if you want the best out of them, they have to see the whole picture because they will add something more. They'll sit there and say, let me do this potentially different because I saw the bigger picture. And they're going to be a lot more successful by sitting in with the people that they think, you know, are not important, but they are important. So listening to potentially somebody that's not a physician, not a nurse, but listening to a home health aide will make a difference how they execute their job.
Wow, that is such an innovative technology you are building there with your team. And I think the
That is
world should be
just it.
proud of you.
I am very proud, and I'll delve into you were saying. I can pivot to what you were saying. You know, the biggest thing that's very hard to accomplish. The clinical is a fairly 1 plus 1. It's complicated, but a blood pressure is a number, right? The blood pressure is a number. It's 160 over 90, 130 over 90. A heart rate is 110. O2 sat is a number. And physicians, yes, that's why they go to school and they work so hard and they understand what's needed. One of the things that people not shied away from, they they couldn't quantify. How do you address it? You asking me, how do you address which is social, the social determinants of health, somebody's social well-being? How do you address that without a human being there? If we have a home health aide in the home, and the home health aide is there 4 hours, that's very, very nice. Let's just say they do their chores, they do the laundry, they pre-pour even their medications, even the time that they do have, they sit and play a game. There is still so many times patients alone, or even, and I think that's also important to state, loneliness is thrown around a little bit. Sometimes loneliness can be with 10 people around you. The person themselves is just lonely. They're with themselves. They're sulking their own problems. They don't
Yeah,
want to even they don't even want to talk to anyone, right? They're
yeah.
not comfortable. Their own sister can be there. They don't want to tell their sister that something's bothering them. They don't want to tell their daughter that something's bothering them. And that's the proudest thing that we've built over the last 5 years is how socially can we engage with our patients? What tools can we give them that, A, if they need to speak to somebody, if it's something that's something personal, certain things are not meant to be spoken in a public forum. Some things are meant to be spoken to one on one, a social worker, a mental health counselor. Some things are best to be done in a group setting, right? You know what they say, misery likes company sometimes, you know, and sometimes people, if people have similar issues, they'd like to discuss it with the group. So what we were able to do, and that's the core at Emerest Connect from its social side, is on the tablets that we have with our patients and on the app that we administer now for all our clients, is at the center of it is a television studio. And that television studio is not your typical television studio that you watch content. What we said is we can put content that talks to them, talks about topics. But that is like anything else. If you and I watch a good show on Netflix, the best of shows, after a certain time, it just gets boring, right? Even if it's a good one, you're very interested in the show, you're not very interested in the show. But what we said is, how can we make that person that's sitting at home, how can we engage with them that they're part of the show? How can we make sure that, the example that I like to give that people are familiar with, the television show Who Wants to Be a Millionaire or Family Feud. Are you
Yeah,
familiar with that?
yeah. I know who wants to be a millionaire.
Yeah. So you know those shows. That is entertaining. It's to watch. Oh, are they going to win $1 million? But what if you're the one that is being asked a question at home? If you're the one that's being asked a question at home and your face comes up on the screen. So imagine being an old person at home and you're laying in a hospital bed and you have a camera and you're comfortable enough that you want to be part of the show. It keeps you engaged. And what we did is what we refer to as an interactive television studio. And that's exactly what it is. So we have elderly populations that get up in the morning and instead of putting on something that they're used to watching, is First and foremost, they see all their friends that they see almost every day.
Wow.
So so you have on our screens hundreds and hundreds of elderly population on the screens, and we see the interactivity because the majority of them sometimes put on the camera early, and we see how their caregiver is making their hair, is doing because they're going on television. So they feel that they're part of something. So besides their interactivity, they know people that they found on the television show. So many times that we will ask patients, and that's part of the data that we collect, what makes you come back? And some of the lots of times, a lot of these elderly say, I really could not go on today. I had a doctor's appointment, but I just wanted to see my friend over there for 5 minutes. I wanted to see her and say hello. So what we were able to socially engage with them and get enormous amount of engagement is to have that interactivity and just not have a boring show or even an exciting show. So besides the fact that it's interactive and the part of it, we have cooking shows and they can ask questions. They can talk to the host talks to them. Now the host and hostesses have a relationship with them. So at that interactivity just made it that much different. And the technology that went into it, going back to what we've built, and for your audience that's doing technology, that took a enormous amount of money, not private equity money. This was sweat and blood, own money. This is money that personally invested my partner and I, Jack. We believed so much in social determinants of health. We wanted that, and our engagement is absolutely fascinating and phenomenal.
That's really, really fantastic. So, speaking on the tech side of things again, scaling any tech platform is not easy. I mean, scaling one that operates across different states, that's got to be a bit more challenging. So, can you walk us through a specific technical or logistical challenge you faced while expanding and how your team solved it?
So first and foremost, if it's ain't challenging, I'm not in. So I just wake up in the morning with, throw it at me just because and I'm blessed, because of my volunteering, I get reminded every day, or every call. The majority of the calls that I deal with are either very small children, right, that are not well, or emergencies, choking, but the majority are elderly at home. So I'm a night medic. I haven't slept through a night in 5 years. I sleep in scrubs. So just, and I see these emergencies. So that's what keeps me going. And I'm so thankful for the organization Atsala, which I volunteer, that gives me this insight and constant push. So challenges is what I live for, and challenges is what keeps us going. Um, to the question that you're asking about scale, when we saw that there's only X amount of patients that will feel that they're being seen and interactive, we said, what can we build? How many patients can we keep that will feel that same level of engagement? What are, if the, once you put on a screen 1,000 patients, it loses, it loses that authenticity of interactivity. So what our team was able to build is, and that's what we're so proud, is we have these holding pens, and the technology team was able to make a system that, a spotlight system, so to speak. How many minutes has this patient been in the spotlight? How many minutes does the patient even want to be on the spotlight? And that all was done with technology. Our technicians in the television studio with our tech team has built out these patients, or this one, they were on screen X amount of time. Let's switch them out. The technology was able to tell us these are the patients that were seen already or were asked the questions. This group was asked the question. So technology was able to give our technology team, our tech team in the studio, easy, fast. They don't have to think, oh, do we pick this patient? No, we know already who was picked. We know already who felt they were on screen. And that gave us part one of being able to scale, first and foremost, making sure how many patients can be interactive and be seen. The second part is what we were able to accomplish is we built these. We first started with a big studio, like, the big CNNs, NBC, with all the fancy spotlights, which I love. Love attention, love the TV producer. I love that some people ask me, what do you do? If I want to really show off, I'm in healthcare and I'm a television producer because it just sounds better and it sounds good. But I'm just being, just having a realistic and honest conversation. But what we were able to do, our team was able to do is, how do you take a studio and make it into a one-man band? How do you take what we needed in a big studio, that you need a floor manager, you need somebody to tech support, you need somebody to switch cameras. So what we built on our own took a lot of time, and what we built is like these pods for hostesses that they have everything at their fingertips. They have screens around them. We built them. It looks like a little bit, if I can try to describe it, like a toll booth, but a technological toll booth, a booth. And that booth has all the tools that we built, our tech team has built. They can actually do it with X amount of buttons, 6 or 7 buttons. This is what switches these people around. This is who they bring up. And we currently built like these mini studios. So we were able to do this at scale. And every of these toll booths, so to speak, these booths, which you need one operator, and the host just does it right then and there, a Zoom on steroids, so to speak, but with their interactivity. And we're wildly successful in doing so and building these individual pods.
Wow, that's indeed fascinating. So, Mr. Klein, looking at the next 5 to 10 years, what emerging technologies, for example, AI, ambient sensing, robotics, etc., do you believe hold the most promise for enabling people to age safely at home?
I think that there's no question that AI is going to give us a better insight in the home that a human can't. Nothing is going to replace empathy. Nothing, a machine is not going to be empathetic towards something. You can put an animated person and tell them to say the right thing. Humans aren't stupid. As long, it's the reason it's called artificial intelligence is because it's artificial. Intelligence is intelligence. Artificial is not empathetic. Artificial is not somebody that genuinely, you can put everything in it, but to not use, and not, for example, you asking, for example, can AI take a picture of a home and with one snap say, you know what? You see that box? You see that wire? You leave it there? That patient is eventually going to trip. That's going to stop that. There are things, AI is going to combine information, going to take loads and loads of information, understanding on the daily basis. Can a camera constantly pick up that they see every time that the patient tries to pick up? Oh, just a second, they're tilting more to the left. Is that a sign of a potential stroke? There's no question that the AI aspect of the clinical side is going to bear fruit if used properly. But to rely on any of these things that are going to emerge is at this time early. Not to say that not we shouldn't use every tool possible, but if we're going to use it as an excuse, or we're going to use it as a way of we've done our part, that's the last thing that technology should be, or AI, robotics. Robotics in the clinical space is saving lives, getting patients out of the hospitals 10 times faster, a lot faster, surgery, right? A human hand is a human hand. A great surgeon is somebody, oh, he has great hands. Nothing is going to beat a robotic, right? If they have to go in to find a little artery and close it with 2 little things that the machine can do, of course, robotics is going to be. Is robotics going to help Hoya lift the patient in home? Yes, but you're still going to need that human to make sure that they are there, making sure. So I'm looking forward seeing what these robotics in the home are going to accomplish. Can robotics clear ways? Can robotics help patients get up from bathrooms be safer in a place that's not safe, a shower, making sure that they're okay. These seats, all these things are, I'm excited that what's to come in that arena. But the caution, and I'm speaking to myself, not to your audience. And that's why I so appreciate your time here, because every time I speak about it, I'm talking more to myself than to you and your audience. Is Josh, don't get suckered into the constant, oh, we got it in order for other people to look at us that we have a fancy tool. So it's reminding myself is see what the needs are first. Does it match what the tool is giving us? But definitely artificial intelligence is going to help us get insight. Robotics is going to help us to be safer, give tools for the people that are administering these type of cares, no matter if you're a physician or a caregiver. So I'm excited to see what's to come, but they're all emerging and they're all going to eventually, with great people, kind people, people that are on healthcare that care, these technologies are going to flourish and going to do well.
Amazing. So, Mr. Klein, tell us, what does innovation mean to you, and how does it relate to your field in the context of healthcare and aging? I'd like to hear the meaning of the word from your own perspective, the way you see things.
Innovation is caring. At the center of innovation is caring. The word is, if you care about who you're trying to help, innovation is just a vehicle. It's a vehicle to propel your caring. It's to innovate and give the tools, figure out ways to help the people that are helping others, find ways to make their lives better, think outside the box. If the things that were done the last 20 years, 10 years, 5 years, what are you adding? Not just because you want to add to look good for others, not because you want to sound good on a podcast, not because you want to be in a newspaper or you want to win an award. These are all motivating things, and there's nothing wrong by that. But innovation at its core is propelling you to think, get the people that care, bring ideas. Take the ideas. Sometimes they're outlandish ideas. If I would tell somebody a couple of years ago that I'm building a television studio, they looked at me like I'm out of my mind. What are you doing? What, a television studio? What does that even mean? And frankly, I don't even know what I was doing when I started this. When I was thinking of it, and I'm not saying it in a knocking myself, but I think innovation is push yourself to something that you're not comfortable. Push yourself in a way that you're not used to. If you're going to do the same thing again and again, repetitiveness, it's just going to get burnt. You're going to get burnt out. You're going to get burnt out by doing the same thing again. If you do something, and some things don't have to work out. I've had more things that did not work out that work out. And in caring, there's no such a thing as feeling bad. If you failed, you still had the patient in mind. You still did the right thing. You never went off your mission. It doesn't have to work. Not everything works. If you just need one good idea, if you even help, and even if the idea helped one person, two people, 10% of your population, 30% of your population, good. Very good. Good. It didn't help anyone. Good. Even if the product ended up not working. But in the interim, did it help someone? Did your innovation, did your caring expand? Did you help someone in the process? Did somebody else pick up, even if something that we're doing, let's just say some of the products fail, but through our innovation or our idea, a company out there in anywhere in the world, in London, in Uganda, in Nigeria, what's the difference where? Somebody read it on LinkedIn and said, I have a population. Let me try something similar. It's not, and the second healthcare is about myself, my company, the people I care about, then that's not an innovator. Innovator to me is what can others see from you? It doesn't matter. It's not a matter about your bottom line of your business. What can you showcase to the world without having to have a risk and reward all the time? Innovation is at its core, put it out there, works for your population and your business, all the power to us. But if somebody else took our idea and he went to a different area, not the population that we serve, but he has a population that's dealing with drug abuse. or any other thing, and he used it. That's innovation. That's innovation to me. Give back, push, let them see, let others see. Don't hide it. Showcase. It's not something to hold on. Yes, I'm not giving the code away what we built on all our technologies. That's that. But I might put my when you talk about the word innovation is let the world see, let them come up with other ideas. You're only as smart as the people that are around you, and the people that are around me. I'm blessed to have such amazing people, and the people that are learning from it. That's what propels me. If there are others that are going to pick up without me even knowing.
Wow, such an innovative way to describe innovation. Indeed, amazing. So, finally, for listeners who are inspired by your mission, whether as potential innovators, caregivers, or families looking for solutions, where's the best place for them to learn more about Emerest and your work?
It's www.emerest.com, and we're in the states that we operate. There are some amazing operators besides ourselves. There's some good people. The people that are in this space, home care is only expanding. Um, do your research. Who's best for in your place? There's plenty of information out there. Um, and I appreciate the opportunity speaking to you. You most definitely bring the best out of me to speak my mind, and God bless you for it.
Oh well, thank you very much for coming up the show, Mr. Klein. I mean, you are such a busy person. You have a lot of work to do, but you took out the time to come on the show today and give a really, really wonderful conversation. I really appreciate your time, and I'm totally excited to have you on the show today.
Thank you, Eskil. You're the best. Thank you very much.